My pathology is on carotid aneurysms, and I'm going to start off with telling you exactly what that is. So, an aneurysm is the formation of a pouch or bulge at a weakened spot in the arterial wall. Aneurysms can develop in the artery, but mainly the aorta and carotid artery are affected. Carotid arteries supply oxygen-rich blood to the brain, face, and neck region. There are two carotid arteries located on both sides of the neck, which further extend to the brain. An aneurysm can occur in any part of the carotid artery, either in the extracranial region in the neck, which supplies the blood flow to the face and the scalp, or the intracranial portion that supplies blood in the brain. Although carotid artery aneurysms seldomly rupture, blood clots can form in them and obstruct blood flow. The thrombosis has the potential to break loose, which can block blood flow to your brain and could be potentially lethal. So, some causes of the aneurysm. There are many factors that may cause the carotid aneurysm. It is possible to have congenital defects such as Marfan syndrome. Sometimes, as you age, the elasticity of blood vessels has the possibility of being affected. This may lead to the thinning of the walls of blood vessels. However, the most common cause of an aneurysm is atherosclerosis, which is plaque buildup. It is a condition in which the arterial wall becomes stiffened and thickened due to that plaque formation. This may cause weakness in the walls of the artery and prevent adequate blood flow, and the increased pressure of blood inside the artery can cause ballooning in the affected arterial wall. Inflammatory diseases and infectious diseases such as syphilis are also known to cause aneurysms. Other causes such as injury to the brain, high blood pressure, smoking, alcohol, diabetes, family history of aneurysms, and drug abuse can trigger carotid aneurysms as well. Large aneurysms obviously have the greater risk of rupture. So as we look at this picture down here, you will see that the carotid aneurysm has a potential to deform the neck if it's large enough, and it can cause it to bulge out like that. So some symptoms of the carotid aneurysm is, if it's small, it is possible to be asymptomatic, but if symptoms were to occur, they may include the following. So transient ischemic attack, otherwise known as a TIA, is one of the most important symptoms of carotid aneurysms. It is a type of mini stroke where the symptoms are temporary and prevail for only a few minutes or a couple days. Sudden muscle weakness in one side of the body, one side of tingling and lack of sensation, and slurred speech are a few symptoms of a TIA. So you can also have a headache. Severe and sudden headaches is one of the symptoms of a carotid artery rupture. It may be accompanied with vomiting, nausea, neck stiffness, and loss of consciousness. You can have vision problems. The patient may suffer from double vision, blurred vision, and pain in the orbital area if the aneurysm is not ruptured. However, they may be temporary blindness if it has ruptured. A carotid blockage is also another symptom. It can cause blood clots in the carotid artery. This may lead to that blockage and blood flow to the brain, and patient may suffer from a stroke, and unfortunately sometimes that can cause death. Other symptoms can occur secondary to the pressure of the aneurysm on surrounding structures, such as veins and nerves. These symptoms can vary depending upon what is compressed, but it can include facial swelling, hoarse voice, or difficulty swallowing. If these symptoms occur, or in order to prevent these from occurring, treatment may be warranted. So those treatments could include, well, first we'll start off with diagnosing a carotid aneurysm. To diagnose an extracranial carotid aneurysm, your doctor will perform a physical exam and ask about any symptoms you have. He or she may order a diagnostic test such as an angiography, CT scan, an echo, or an MRI. The goal of treatment is to reduce the symptoms and reduce the risk of complications. Each patient will be evaluated and treatment will be individualized for the patient's circumstances. If the aneurysm is small and not causing any symptoms, your physician may recommend watchful waiting by closely monitoring your condition with ultrasound, CT, or MRI scans every 6 to 12 months. The aneurysm will be watched for signs of changes. So if you have, as far as treatment, if you have high blood pressure, your physician may prescribe blood pressure medication to lower the overall blood pressure and the pressure on the weakened area of the aneurysm. Additionally, if applicable, your physician may prescribe a cholesterol medication to lower the levels of high cholesterol and this will maintain the health of your blood vessels. Thrombolysis may be used to eliminate clots that are blocking blood flow. Thrombolytic therapy used drugs designed to dissolve clots and restore normal blood flow. Your physician will inject a clot-dissolving medication into a blood vessel. A catheter may also be used to deliver the medication or to break up the clot. So these two pictures right here are ultrasound pictures of some examples of what a carotid aneurysm would look like. So this one is showing the bulb and showing that it is enlarged, and then this one is showing one in the ICA as it is coming out of the bulb, and that is enlarged as well. So lastly, we will go to surgical repair. Option 1, the surgical repair entails the resection of that portion of the carotid artery that is involved with the aneurysm. A bypass is then performed from the normal artery below the aneurysm to the normal artery above the aneurysm. The bypass may be performed with a variety of different conduits, including a piece of vein taken from the leg, a piece of artery taken from another spot in your body, or a prosthetic graft made out of Gore-Tex or polyester. So surgical repair option 2, that was option 1. Option 2, you can have an endovascular stenting. Endovascular means that surgery is performed inside the artery using thin, long tubes called catheters. Eligibility on this surgery depends on the size of the aneurysm and its location relative to other branches of the carotid artery. Your surgeon will enter through a puncture made in one of the arteries in the groin, using catheters to guide and deliver a stent graft through the blood vessels to the site of the aneurysm. X-ray guidance is used to position a graft made of artificial material to the area of the aneurysm. The graft is then expanded inside the artery and held in place with metallic hooks rather than sutures. Besides the conventional and surgical treatment, the patient has to alter their lifestyle. He or she has to quit smoking and alcohol intake, eat a diet that is low in fat and cholesterol, exercise regularly, and keep blood pressure under control. So lastly, we will look at this angiogram of the carotid. So this case study is showing that aneurysm on the right internal carotid artery in a 4-year-old patient. So the image A is showing that the right internal carotid angiogram before embolization shows the right ICA aneurysm. And then image B shows the angiogram obtained after embolization shows occlusion of the aneurysmal sac with only 1 minute contrast within the coil mesh. And then image C shows an angiogram at a 1-year follow-up shows no further recanalization. Note that the superimposition of the curving ICA contour at the base of the aneurysm, which may lead to a false impression of a residual neck. So that concludes my pathology of a carotid aneurysm.